Welcome to Wellness Wednesday. As a registered respiratory therapist, I was curious as to how COVID-19 affects the lungs. And during my research, I came across a doctor at Johns Hopkins Hospital, Dr. Panagis Galiastos. He is an expert on lung disease at Johns Hopkins Bayview Medical Center and sees patients with COVID-19. He explained some of the short and long-term lung problems brought on by the new coronary virus. And he said, like other respiratory illnesses, COVID-19, the disease caused by the new coronary virus, can cause lasting lung damage. As we continue to learn about COVID-19, we are understanding more regarding how it affects the lungs while people are sick and after recovery. So what type of damage can coronary virus cause in the lungs? And he said COVID-19, the disease caused by the new coronary virus, can cause lung complications such as pneumonia and, in the most severe cases, acute respiratory distress syndrome or ARDS. Sepsis, another possible complication of COVID-19, can also cause lasting harm to the lungs and other organs. So the COVID-19 pneumonia. In pneumonia, the lungs become filled with fluid and inflamed, leading to breathing difficulties. For some people, breathing problems can become severe enough to require treatment at a hospital with oxygen or even a ventilator. The pneumonia that COVID-19 causes tends to take hold in both lungs. Air sacs in the lungs fill with fluid, limiting their ability to take in oxygen and causing shortness of breath, cough, and other symptoms. While most people recover from pneumonia without any lasting lung damage, the pneumonia associated with COVID-19 may be severe. Even after the disease has passed, lung injury may result in breathing difficulties that might take months to improve. So, acute respiratory distress syndrome. He said as COVID-19 pneumonia progresses, more of the air sacs become filled with fluid leaking from the teeny blood vessels in the lungs. Eventually, shortness of breath sets in and can lead to acute respiratory distress syndrome, ARDS, a form of lung failure. Patients with ARDS are often unable to breathe on their own and may require ventilator support to help circulate oxygen in the body. Whether it occurs at home or at the hospital, ARDS can be fatal. People who survive ARDS and recover from COVID-19 may have lasting pulmonary scarring. Sepsis. Another possible complication of severe case of COVID-19 is sepsis. Sepsis occurs when an infection reaches and spreads through the bloodstream, causing tissue damage everywhere it goes. Lungs, heart, and other body systems work together like instruments in an orchestra. Galiastos says in sepsis, the cooperation between the organs falls apart. Either an entire organ system can start to shut down or at one after the other, including the lungs and the heart. Sepsis, even when survived, can leave a patient with lasting damage to the lungs and other organs. Superinfection. Galiastos knows that when a person has COVID-19, the immune system is working hard to fight the invader. This can leave the body more vulnerable to infection with another bacterium or virus on top of the COVID-19, a super infection. More infection can result in additional lung damage. 3 factors in coronary lung damage. Galeastos notes 3 factors that can affect the lung damage risk in COVID-19 infections and how likely the person is to recover and regain lung function. 1 is the disease severity. The first is the severity of the coronary virus infection itself. Whether the person has a mild case or a severe one, Galeastos says that milder cases are less likely to cause lasting scars in the lung tissue. 2. Health conditions. Galeastos says the second is whether there are existing health problems such as chronic obstructive pulmonary disease, which is COPD, or heart disease that can raise the risk for severe disease. Older people are also more vulnerable for a severe case of COVID-19. Their lung tissues may be less elastic and they may have weakened immunity because of advanced age. And thirdly, treatment. Treatment is the third factor. He says a patient's recovery and long-term lung health is going to depend on what kind of care they get and how quickly. Timely support in the hospital for severe ill patients can minimize lung damage. So then the question is, can coronary virus patients lessen the chance of lung damage? And he says there are things patients can do to increase their chance for less severe lung damage. And he says if you have a health issue that puts you at high risk, make sure you're doing everything you can to minimize that. For example, people living with diabetes, COPD, or heart disease should be especially careful to manage those conditions with monitoring and taking their medications as directed. Galeastos adds that proper nutrition and hydration can also help patients avoid complications of COVID-19. Staying well fed is important for overall health. Proper hydration maintains proper blood volume and healthy mucous membranes in the respiratory system, which can help them better resist infection and tissue damage. So my friends, I hope with this wealth of information, you do your part, or we all do our part, by adhering to the CDC guidelines so we can prevent COVID infections. The CDC guidelines such as cleaning frequently touch objects and surfaces and also disinfecting it, social distancing, washing our hands frequently, not touching our faces, and wearing a mask when we go into public settings, and also staying 6 feet apart when you're outside or you're in a social place. So I hope we all adhere to these guidelines so we can all stay healthy. Stay healthy and wear your mask.